welcome to this special show. The COVID-19 pandemic has had positive and negative impacts on various aspects of lifestyle behaviors. Negative lifestyle behaviors are associated with an increased risk of adverse outcomes from COVID-19. While dealing with the pandemic, we've overlooked the fact that people's lifestyles have been severely disrupted. Many people have become physically inactive. They've developed irregular eating habits, which in turn has also led to unhealthier lifestyles, also aggravation of lifestyle-related diseases. Now, COVID-19 has caused significant changes to our lives, our work, our stress levels, and that's why a multi-sectoral, multi-dimensional approach to better health is probably more important than ever before. As always, we're joined by medical experts on the show who will tell us exactly what we can do to prevent or control lifestyle diseases and lead a healthier life. Joining us on the show today, Dr. Amarta Shankar Chowdhury, MD, DM, Endo, Consultant Endocrinology with the Mission Hospital in Durgapur in West Bengal. We're also being joined by Dr. Prashant Udgire, MBBS, MD, General Medicine, DM, Cardiology, Professor and Head of the Department, MGM Medical College, Aurangabad, and Dr. Brajesh K Badhan, MBBS, MD Medicine, DNB, DM Cardiology, Director and Chief Cardiologist and Interventionist, Global Heart and Super Speciality Hospital, Ludhiana. A very warm welcome to all of you. Dr. Amarta Shankar Chowdhury, let me begin with you. Initial data has detected greater transmissibility, but what remains key to stopping the spread of the Omicron variant is faster detection of the variant itself. Can Omicron be detected by RT-PCR tests?
Thank you. Thank you so much for the question. And since you're starting off with the discussion on COVID-19, the Omicron probably is the latest variant of concern which has been detected, as we all know, in South Africa last November. And yes, the initial data, we have seen that there is a very high risk of transmissibility. So probably that is really something which is concerning. But having said that, it is probably just like any other variant of COVID-19 virus which you have had in the past 2 years, like the Alpha, Beta, Delta. And these have been detected by the RT-PCR tests. So most likely even the Omicron is going to be or should be detected by the available RT-PCR tests we have as of now. But the key to break or prevent this transmissibility is probably to continue to follow the COVID-appropriate behavior. We should vaccinate ourselves as early as possible if we have not yet got vaccinated.
Right. Dr. Prashant Udgire, it's said that existing vaccines could be less effective against this fast-spreading coronavirus variant. We're seeing Omicron cases multiplying globally. Is it true that it's vaccine resistant to some extent, or that vaccines are less effective in dealing with it or protecting from it?
It is too early to say, to make such statements, but the recent data has shown that the newer vaccines are not able to overcome the Omicron virus. Fewer companies has come up with their global data, and we should not help to spread the panic in the society. We still need to wait before the much more reliable and scientific data came up, and which shows the current vaccines are less effective.
Right.
Till that time, we should continue with our vaccination program. And fewer studies in US and UK has also shown that those who have taken 2 doses of vaccine have a milder disease, as well as they have less mortality compared to the unvaccinated persons who
Right.
land up in the hospitalization. So we should continue with our 2 doses vaccination and complete it. And later on we can think of a booster dose which will help to prevent the reinfection or reinfection with a variant
Right.
of the virus.
I think globally countries are really pushing for vaccinations, existing vaccinations to be completed, and then in several countries booster doses are also being given, though right now not in India yet. However, that could perhaps change given the fears over the Omicron variant. But Dr. Brajesh K Badhan, which organs of the body are going to be more severely affected by this new variant Omicron from what we know now? Are people with heart conditions more at risk from the new COVID strain?
Yeah, I think, see, there is a lot of talk and speculation about the new COVID variant Omicron, which has been labeled as a variant of concern by the World Health Organization. Now, several medical bodies, they have already told about the high transmissibility of the disease. But let me tell you, it is the virulence which will tell us how severely the various organs of the system should be affected. In fact, more data is needed to know whether the Omicron infections or reinfections will cause more severe disease of the body and affect vital organs. In fact, Dr. Coetzee of the South African Medical Association, she said that in a series, basically the people who were affected, they were having very mild symptoms. In fact, the most common symptom, what she recorded was general fatigue, which lasted for 1 to 2 days. And no Omicron-related myocarditis or any severe disease affecting the cardiovascular system was observed in a study. So coming to the second part of the question, I think if this virus is found to be more virulent, yes, people with heart disease will be more affected. And they'll have a more severe affection with this COVID variant.
Dr. Chowdhury, it's believed that a person with sort of negative or bad lifestyle behaviors is more susceptible to diabetes and other chronic conditions. But can a person with a reasonably healthy lifestyle, who's careful about what he or she eats and how much exercise levels there are, also have diabetes? And, if that is indeed the case, then what's the cause behind that?
A very important, pertinent question that. If you're talking about lifestyle, probably we are meaning type 2 diabetes. Now, we have to know that we have basically different types of diabetes. We have the type 1 diabetes where the patient is completely insulin deficient and needs insulin for survival. Then we have the type 2 diabetes, probably which is the most common diabetes which you all come across. Then there are other rarer genetic forms of diabetes, then diabetes in pregnancy. So related to lifestyle, we mean type 2 diabetes. Yes, lifestyle modifications, diet, exercise are definitely a key to prevent diabetes and also to control diabetes. In spite of this, we must understand that diabetes is basically a multifactorial disease. There are other genetic factors, environmental factors, then family history. Now, if you have a patient who has a first degree or a second degree relative who is diabetic, then he has a high risk of developing diabetes. Then even with lifestyle changes, if the person is still obese or overweight, then he can again develop diabetes. Then if the patient has hypertension, high blood cholesterol levels, in female or in a lady who is having some disease called PCOD or polycystic ovarian disease, a lady who was pregnant and then during pregnancy her blood glucose levels were quite high and it became normal after pregnancy, then these are the group of individuals, even if lifestyle might have some added risk of developing diabetes, and we need to be cautious and we need to monitor their blood glucose levels at a time which is recommended by the doctors or the governing bodies, and then take appropriate management or care.
Right. So, Dr. Prashant Udgire, let me ask a follow-up to that. With a healthy lifestyle, with regular exercise, with a nutritious diet, can one completely reverse heart disease or reduce the risk of developing heart disease in the first place?
No, completely reverse. But with regular exercise and good diet, we can reduce the development of the heart disease. If you see the formation of atherosclerotic plaques, it starts at the age of 2, but its rate of acceleration doubles after 40 years of age. So previously we see the heart disease in 50s and 60s, but now the rate of acceleration doubles at the age of 20, and then we are getting heart disease at 30s and 40s. So lack of physical activity and increases the risk of developing the heart disease, diabetes, other lifestyle diseases, other lifestyle related disorders, as well as the stroke and other clotting factors. So if we do a regular exercise and it will help to maintain our body as well as our mental health. So if we do regular exercise, do proper eating habits, that good healthy food is with a lot of green vegetables, fruits, and other less dairy products can help to maintain your weight and decreases the risk of heart disease as well as other lifestyle related diseases.
Right. Dr. Brajesh Badhan, diabetes generally comes with other comorbid conditions. Hypertension is one of them. But, tell us a little more about the link between hypertension and diabetes. How does hypertension affect diabetes?
Coming to your question, see, basically diabetes comes with various comorbid conditions. And in fact, there is a clustering of various cardiometabolic factors in a syndrome, what we call as metabolic syndrome, where diabetes, high blood pressure, obesity, and high cholesterol, especially triglycerides, and low HDL, they coexist together. Now, coming to hypertension, as I told you, it is one of the most common comorbid condition which is associated with diabetes mellitus. In fact, more than 75% of the patients with diabetes, they have coexistent hypertension. And once these hypertension exists with diabetes, it creates havoc in the body. I mean, what various studies have shown that all the various micro as well as macrovascular complications of diabetes, they are aggravated and hastened. In fact, they get accelerated and people suffer more severe disease of the eyes, kidneys and cardiovascular system, which comes earlier, maybe 5 to 10 years earlier than in normal people who don't have hypertension.
We've been discussing the fears over the Omicron variant of the coronavirus and what this is going to mean in terms of people with pre-existing comorbidities or, for that matter, for the development of lifestyle disorders following COVID-19. We'll continue to answer all your questions. We'll be back in just a moment right after this quick break. Welcome back to Beat Diabetes, Myths and Facts. Let's go right back to our medical experts. Dr. Amarta Shankar Chowdhury, how would you recommend a person with diabetes cope with stress, especially stress that pertains to actually living with a chronic condition? Do exercise, yoga, meditation actively have an important role to play?
Yes, stress is a very important factor. Sometimes we neglect while treating our patients. Stress, both physical as well as mental stress, is an important factor which is related to these lifestyle diseases like diabetes, hypertension, heart disease. Exercise, yoga do help. Now, yoga is a very age-old Indian custom where it involves some breathing exercises, some postural physical exercises. Now, we have scientific data to show that some of the data have shown that yoga can reduce the blood glucose level, the blood pressure level, blood cholesterol level. But it should be an adjunct to the diet, exercise, diet, and the pharmacotherapy or the medicines. It is not that you can stop your medicines and just practice yoga. If you do need medicines, you have to continue the medicines. And at the same time, yoga and exercise, meditation do help in controlling this lifestyle diseases. It can improve the outcome if we continue to follow a diet, healthy diet, lifestyle changes, exercise, yoga, and also take your medicines at the appropriate time. Is definitely going to be very beneficial for the patient concerned.
Right. Dr. Udgire, who is at higher risk of cardiac arrest? Can any steps be taken to reduce the amount of risk? And does sudden cardiac arrest mostly affect the elderly, or can it actually happen across age groups?
Yes, sudden cardiac arrest is not a heart attack. It is the malfunction of the electrical system of the heart, and which causes the arrhythmias, irregular heart beating, very rapid beating like ventricular tachycardia as well as ventricular fibrillation, It is most common cause of death in patients with sudden cardiac death, in whom heart function stops suddenly, and it occurs more in men, twice more in men compared to women, and it occurs generally in the mid 30s and mid 40s. So these type of patients, we have seen some of the athletes collapsing in the field suddenly. It is shocking, and we may be in disbelief, but it can cause the sudden cardiac death. Sudden
Right.
cardiac arrest.
Yeah.
Most common risk factors for the sudden cardiac arrest are previous heart attack, which causes the scar formation and development of arrhythmias.
Right.
Then previous coronary artery disease. Patients with family history of sudden cardiac arrest or sudden cardiac death are more susceptible for development of sudden cardiac arrest. Then hypertrophic cardiomyopathies. Some of the myopathies, they are known to cause abnormal functioning of the electrical system of our heart. They are more prone to develop sudden cardiac arrest.
Right.
And patients with obesity, diabetes, they are also more susceptible for the development of abnormal heart rhythm.
Okay.
If this type, yes,
Right.
if this type of patients
Yeah.
get treatment within minutes, there is a chance of 90% recovery. And every minute lapses, then there is a 10% decrease in the recovery.
Okay. Okay. Let me ask a follow-up for this to Dr. Brajesh Badhan. So who is it that, what kind of patient will actually survive that kind of sudden cardiac arrest? And after being resuscitated, can the survivor be able to resume a normal life or can there be complications in the future as well?
Sudden cardiac arrest basically is a condition in which the heart stops beating suddenly, and it is very different from a heart attack. Now, people confuse sudden cardiac arrest from a heart attack. Heart attack is a condition in which the blood flow to the heart suddenly decreases and patient suffers a myocardial infarction or a heart attack. So once a patient suffers a sudden cardiac death, in fact, the disease is quite common. And what people say, various studies have shown that more than 1 million people in India, they suffer from sudden cardiac arrest, out of which unfortunately only 8 to 10% of the people survive. Now, with prompt intervention means cardiopulmonary resuscitation. So with the cardiopulmonary resuscitation, this survival rate can be doubled or tripled in patients. As far as people who survive post-survival complication, it all depends on how much residual brain or heart damage the patient has suffered. So if a patient was received a CPR very early and he doesn't have any residual brain damage or a heart damage, I think he should do well in his afterlife, what we call nowadays.
All right, we'll leave it at that. Thanks very much indeed, doctors, for joining us on the show. We hope this has been useful in answering your questions as we look at the fears over the Omicron variant and what this is going to mean for people with comorbid conditions. This is a program that tells you how to focus on living healthily and keeping your parameters in check.